Welcome back to Mindset Mental Health News and Information. I'm your host, James Curtis. We had a technical glitch at the initial attempt at this broadcast a few minutes ago. I apologize. I'm going to dispense with the news reading since I already got through that and get right to the interviews. I had interviews with a couple of guests on the subject of homeless children and the mental health challenges that they face. The first guest you're going to hear from is Sam P.K. Collins. He is a journalist with an online publication called Think Progress. Here's that interview. All right, my guest is Sam P.K. Collins. He's with the publication Think Progress, and he's a health reporter there. And the publication, or the article rather, that I'm talking to him about today, an article that posted on the 23rd of February entitled An Inside Look at the Mental Health Epidemic Plaguing Homeless Youth. Sam, thanks so much for joining me. First of all, tell me how you got interested in this particular topic and doing this particular story.
Well, thanks for having me. My interest in this particular topic just came out of what I've seen growing up in Washington, D.C., and just in reporting at Think Progress. When I first reported here, it was pretty much my first time doing comprehensive health reporting, so I just explored the field for the first couple of months. And as I started building a niche for different kinds of health news, mental health news pretty much struck a chord with me. Just reading articles and reading data from those articles about what children go through and about what's often misdiagnosed as misbehavior or just acting up when it's children giving these silent cries for help because of the trauma that they experience. And in just reporting, I found out more and more how, in fact, many people, not everyone, but a good majority of people have some form of mental illness, whether it's diagnosed or undiagnosed. And reporting on that has helped me just report on other issues and find other fallacies and other gaps in healthcare, pretty much.
So, give us the overall picture. In your article, you talk about a study out of North Carolina State that had some very startling information. Give us the big picture.
So, the big picture is that if you're a homeless youth today, it's very likely that you will have mental health issues, and it's even more likely that you will end up being homeless yourself. And scientists and public health officials started seeing these trends in about 2013 when the homeless youth population skyrocketed or increased significantly about 8 percentage points. And people in the field, they point to that increase for two reasons. First of all, there's negligence on the part of state officials and health and human services officials, a negligence toward homeless families. You know, they have services for homeless individuals, particularly those who are veterans, but none for homeless families. So you have families who are going from couch to couch, from shelter to shelter, sometimes on the street. And these families are most of the time led by single women, and these single women have children who are under the age of 10. Imagine being under the age of 10 and going through all of these issues while on the street. That messes up your cognitive abilities. You're undergoing a period of rapid development, so you can't even get the nutrients that you want. You can't even have a stable environment. That does a lot of things to a child. And so when it comes to going to school and it comes to getting a good education and just being a normal child, the lack of a stable home interrupts that period of development. And if left unaddressed, that materializes into mental health problems down the road, such as schizophrenia, bipolar disorder, and whatever else you can imagine, pretty much. And that was the entire premise of the study out of North Carolina, that these children are being ignored by the system. And what you see here, because they're being ignored, this perpetuation of a cycle of homelessness, particularly homelessness in connection with mental illness.
So in the areas where this type of homeless issue is prevalent, particularly urban areas, what's being done?
It's different from state to state, urban locality to urban locality, but the issue is being raised. One thing that a few states are toying with, surprisingly, red states, they're trying to tie Medicaid dollars to stable housing pretty much. So right now, people don't consider lack of housing a disease. And legislation at the state level in Texas, and there's something underway in Washington State right now, but that's being held up in the legislative part of the government. This legislation would make lack of housing a disability pretty much. And when they change that definition, families or single mothers or whoever else is dealing with lack of stability, they can, or dealing with that in addition to an addiction or whatever else they may have, they can get housing paid for with their Medicaid dollars pretty much. So that's one thing that they're doing. Another thing that people are trying to do is expand shelters and create new shelters, but increasingly we see that that's not the way that people in the public policy field want to go, just because if you're talking about long-term effectiveness and just use of dollars, that's pretty much very ineffective. We're really going towards this school of thought where we want to give homeless people long-term housing, and we want to provide them with the tools that they need to maintain their housing. So instead of just giving you a house to live in and wishing you the best, we want to give you a job, money for food, substance abuse counseling, medical coverage. So all of that comes into play when you're talking about the Affordable Care Act and what it provides for these families. It's just thinking beyond the issue. When talking about homelessness and mental illness, the school of thought now is just thinking beyond the individual and their plight and thinking about the key factors that cause that plight pretty much. So there's a lot of talking, but as far as moving toward a solution that's more sustainable and more longer term, some states are moving faster than others, unfortunately.
Is it accurate to say that there is, based on people who study this, a more comprehensive approach that deals with, as you alluded to a moment ago, the overall situation of the individual? Not just give them a house, but certainly provide the services that are going to help them alleviate in a longer term sense what they're going through, their condition of homelessness. Is that accurate?
That's very accurate, and you see it all across the board, especially when it comes to mental health. They have this thing now called the collaborative model, where, especially when it comes to children with mental illnesses, they include family members, schools, and police officers, people who these children might come into contact with. They include them in the care, and in recent years, they've equated mental health to physical health. As you've seen before Obamacare passed, people really couldn't get coverage for their mental health services with their insurance. But now, thanks to the ACA, that's not the case anymore. People, they can receive coverage for prescriptions they may need or visits that they have in the doctor's office. So you do see a shift in this school of thought. When it comes to children, when it comes to ex-offenders returning home, it's just a matter, people are getting smarter about how to solve this problem. And people understand more and more that mitigating the factors of mental illness is not wasting money. It's a matter of a financial investment. Does it cost more to give someone a house to live or to move them from shelter to shelter than it would cost them to just give them the services that they need so that they can be on their own and get their own housing? Of course it costs a lot more money, because you're creating a culture of dependency. What they want to do, and when I say they, I'm referring to mental health practitioners and other players, what they want to do is give people the tools that they need to stand up on their own 2 feet and to handle their mental illness well and on their own eventually.
Now, one of the things that you note in your article is that a number of homeless youth are facing this issue alone. Flesh that out for us a little bit.
Sure, I can flesh that out for you, definitely. And that goes back to two things. The first thing being broken families. A lot of these youth who come out on their own, they have stories that are unique but are not so unique in America. Many of them have been physically abused, sexually abused by family members, stepfathers, mothers, boyfriends, whoever you have it. And when that happens, oftentimes the mother or the grandmother or whoever else takes the side of the abusive partner over that of the child. So the child feels no choice but to leave the house, and they leave the house without any support system, and they leave hungry, and they leave traumatized by that abuse. That's one case. The second case that I highlighted in my recent article is that of LGBTQ children, those who are ostracized from their family members. Once they come out of the closet and their family members don't take a liking to what they just heard, they're often put out on the street. Or if they're not put out on the street, these children feel like they have no choice but to turn to the street. So, and as the article stated, LGBTQ homeless youth are usually at a higher risk of physical and sexual abuse while on the street, just because of discrimination. And in recent years, some shelters have also tried to turn a blind eye from LGBTQ youth, particularly those who are transgender.
The Centers for Disease Control describes parents and school administrators as those folks on the front lines of this issue. Do you agree with that?
I agree with that to a certain extent. And, of course, I'm saying that to say that in a perfect world, a child can have his or her parents there to listen and to see the signs of abuse and to see the signs of mental trauma. But, of course, it's not the case. We're living in America where minimum wage is a huge issue, and people usually have 2 or 3 more jobs, and they may not see their children, which is why the schools are the front lines. Children spend up to 8 hours a day in school. If you're in a school with wraparound services, probably more than that, between the free breakfast program, the hours of regular instruction, and the extracurricular activities. So schools have to be on the front lines because children are there most of the time, and if parents aren't interacting with children because of their employment obligations, then teachers and other school officials most likely are. So going back to my point about that child acting up in school and about that child just not listening and being fidgety. Decades ago, school administrators most likely would have sent that child to the office. Or if you're in an urban community and you're a boy of color, you would have most likely been handcuffed because that's what they do to some children of color in low-income communities when they exhibit these signs of mental trauma, lashing out at teachers and lashing out at administrators. That child is not bad. That child is just trying to show you the signs that he needs help and that he's trying to express himself to you, but he doesn't know how to express himself to you. So that's what the CDC means, at least from what I see, when they say that teachers are at the front lines of the mental health epidemic as it relates to children. Teachers will most likely be the first to see the signs, and that's why it's important. They need to be educated on what the signs are of mental trauma before it becomes too late, because if it's often later after a tragedy, as we've seen in Sandy Hook, where teachers and principals start talking about mental health. But you can definitely be more proactive in your approach if we just train teachers on how to notice the signs of mental trauma and ask the right questions when children get put to the side and sent to in-school suspension or whatever.
You mentioned a moment ago red states and how their approach with respect to this issue rolls out or plays out. Do you see a trend or a difference in the political orientation of a particular community or state and how they deal with this issue? Or is that significant?
Not at all. I don't think it's significant. I think it's just a matter of the red states being fiscally conservative, as they always are. You see in all these cases that members of the GOP, no matter where they are, they just like saving money. And the figures add up. And they show that giving a homeless person, especially a homeless person with mental health issues, giving them the tools they need to pull themselves up by the bootstraps and to have their own supportive housing eventually is a lot more cost effective than just moving a homeless person from house to house or shelter to shelter while keeping in mind the reasons why they've gotten into this moment of homelessness.
Where we are now with respect to this issue, would it be accurate to describe it as there's a gap? There's a gap between what some might call best practices in terms of dealing with this issue, a wraparound approach, a comprehensive approach, and the way we've always done it, which is inadequate. There's space between those two, and we've got some catching up to do overall as a community and certainly as a country.
Well, we do have some catching up to do on two fronts, on both the legislative front and on the personal front, as far as on the ground, pretty much. Because even with all the policy, and speaking of policy, legislators have tried their best to overhaul the mental health care system, but there's just some stuff going on in Congress. There are 2 bills up right now, and they're trying to put it together, but that just hasn't happened. You see, the Obama administration, they tried to improve the quality of mental health care, and they tried to make sure that the ACA covers mental health care services in the past. So people are realizing it, and stuff is being done on both the national, state, and local front to address mental health care issues, but it all goes down to the stigma. How are we going to change the stigma of mental health, and how are we going to stop mischaracterizing people with mental health disorders as crazy people and people who cannot be controlled? And how do we destigmatize it to the point that if you or I have a mental health care issue, we can go to our doctors and our primary health care physicians or whoever else and talk about that without feeling ashamed, pretty much. So it's about changing the narrative on those two fronts. There's stuff being done nationally and on the state level when it comes to legislation, but it's about changing the stigma. That goes for any type of law. You can't legislate people's thoughts at all. And, what the First Lady has going on with this new initiative, changing the direction, I think it's a very good first step. And people might criticize it and say, well, it's just a bunch of talking, but sometimes that's what we need. We do need to have a conversation about mental health. We need to have a conversation about what's going on in our families and with our friends, because, if we don't have it, then how do we address that issue?
All right. Anything that I didn't ask you about, Sam, that you want to talk about?
I think the next frontier for mental health care and for the whole debate about mental health, that's something that you should look out for definitely, is this whole debate about prescription medications and what some may perceive as the over medication of mental health care patients. There's a school of thought out right now that, if you just medicate people with bipolar disorder, well, when it comes to ex-offenders at least, there's a school of thought that if you just give them their meds, they should be good to go. But mentally ill ex-offenders, just like their counterparts who may not be classified with mental illness, they have the same set of needs: place to sleep, bus fare, job prospects, whatever have you. So this dependence on medication, and people are saying this now. You look on the internet, you read your papers. There's a prescription pill epidemic out there, and that'll be the next frontier of the whole mental health discussion. How do we go about mitigating the symptoms of mental illness, and how do we go about addressing the issue? Do we just prescribe people, or do we prescribe people in addition to providing different sorts of therapies that would help them? Or do we just scrap the whole prescription medication system as a whole? But that probably wouldn't happen for a long time anyway, even if they suggested that.
Sam P.K. Collins, he is a healthcare reporter for thinkprogress.org, an outstanding report. And thank you, Sam, so much for that report. Now, you heard at the beginning of my conversation with Sam a reference to a study out of North Carolina State that talked about studying and assessing what the issues were with homeless populations, particularly getting these service to kids who are part of homeless families. I was able to catch up with one of the co-authors of that report. Her name is Jenna Montgomery Armstrong. Give me, as a co-author of the work, your overview of the work and its importance.
So we did a large-scale study that followed 300 children between the ages of 2 months and 6 years. As they entered shelters, there was a community agency known as Project Catch, which is community action targeting children who are homeless, who go out to the shelters and do these developmental and social emotional screenings for children. And we took all of their hard work and made it into some data to run statistics to see how these children were functioning. And we found things that really aligned with the current already existing literature, but it really set home and kind of spoke a little bit louder to our community. And what we're hoping is that by getting this type of media attention, we can really advocate for the needs of screenings of children when they enter shelters, so that their needs can be identified. Because so often when children enter shelters, they're completely overlooked. Sometimes they're not even asked about because they're more worried, parents are more worried about, finding a place to sleep for the night and where they're going to get their next meal. And so oftentimes children who are experiencing homelessness are severely overlooked in those situations.
Talk to me about some of those needs that you identified that often get overlooked.
Yeah, so children who are experiencing homelessness are at significantly greater risk than their counterparts who are living in stable housing. So, for instance, later in life, children who have experienced homelessness are more likely to drop out of school. They're experiencing significantly higher rates of mental health concerns. And they're also experiencing some significant language and academic delays, according to our screening data that we found.
What types of strategies are useful in addressing this issue, given that the population that you're talking about moves a lot and the very nature of their instability? Can't that make it difficult to deliver the services that they need?
Oh, definitely. And that's why it really takes integrated care from several different community resources to provide that care that they need. And so in our community, we're really working with this community project known as Catch that I just described a moment ago. And what they do is they take an integrative care approach. So the Catch service workers will go out and identify needs and then make referrals to outside services. And then if necessary, they can even aid in getting them transportation to those services and work with the parents to continue those services once they're no longer in a shelter environment.
One of the things that I talked to the reporter who covered this story, Sam P.K. Collins, was the idea that the model is wraparound services, where you're talking about delivering services in a more comprehensive manner that cross various what might be known as traditional boundaries of services. So the school, where they're living, the insurance through the ACA that's available now, sort of making that all come together. Is that accurate? Am I understanding that correctly?
Yes, it is. Wraparound services or integrative care is really what Catch is working to do in our community. And then how we're finding their significant needs really are present. We're hoping will advocate for all children receiving these screenings, because the small number of children that we have these screenings in is a dot on the surface of a much larger problem. And in some states and other communities, even counties outside of where we are in North Carolina, these screenings aren't taking place and children are not getting any type of the services they need despite their high-risk status and issues that they're experiencing developmentally and social-emotionally.
What's the biggest obstacle to delivering these services? Do you have to make a sales pitch to the various departments that would otherwise deliver these services to convince them to do it? Or is it more of a practical, how do you get the services to this population?
It's somewhat of a practical, how do you get these services to this population, but then it's also advocating for the needs of this population. And so, people are really unaware of the needs of this population in general. And so I think really starting and advocating and say, because these children often go invisible. When people think of people experiencing homelessness, they don't picture whole families, because those are the people that you see living under bridges or in parks. They're doubled up, or they're in a hotel, or they're in a shelter. And so I think the bigger problem is just identifying them and everyone being aware that they exist is kind of the first step, and so that we can advocate for, more funds to provide these services to this really high-risk population.
Can you speak to the issue of stigma as an obstacle to this type of service delivery? I mean, stigma is an issue for folks who are stable, who are living, who have jobs, who work every day to get services, to get access to services. There are issues about, do I tell my boss about it? Do I, there's all kinds of issues that impact getting services to folks who need it, who are stable. So is it the same kind of dynamics in terms of stigma? Does stigma play the same sort of role with this population? Is it different? How do you see it?
Yeah, I would definitely say that stigma plays a large role for this population. And so there is a federal law that mandates, McKinney Vento law, that mandates specific school services, and specifically they mandate that a child who is experiencing homelessness be able to attend the same school without having to be moved around if their parents wish for them to. But so many children don't end up getting serviced under this law because parents aren't speaking up that they need the service, and that's kind of like the first thing. So many schools are unaware that kids are even experiencing these circumstances because parents aren't speaking up, because, there is a huge stigma surrounding, like, I can't imagine walking into an administrator or an office clerk at a school and saying, I'm experiencing homelessness, what can you do for me? It's just not something that you hear people say every day. And so that's where, finding them at the shelters or in a hotel or through other community agencies would really come into play in helping break down that stigma for them.
It seems that if it's difficult for folks, again, who are in a stable environment, who have a home, who work every day, who experience a mental health crisis, or certainly let alone live with any type of mental health issue, that it's difficult for the advocacy piece. It's difficult to speak up, difficult to get the services. I would imagine it's even more difficult, or that difficulty is compounded at least, for parents to be able to do it if they themselves are homeless, for administrators to really be able to recognize this issue, for homeless teens, homeless kids, for kids themselves to speak up. Is the onus then left to, or is the best way to make this happen for agencies, community-based organizations like NAMI, or how do you see it? How do we get this done? How do we make it happen?
How do we make it happen? All right. We have to think baby steps. So we can't go from this population that is completely invisible to, demanding that they have all of these services. And so, starting at a very basic level of just increasing awareness that these children and families are out there, and that it is a large problem that our society experiences, and that you don't have to go abroad, to work with children in need or to find families that are in significant need of help or support, is where I would really like to start. So baby steps and just raising awareness that these families even exist.
And perhaps if folks are interested in helping or trying to, as you say, instead of going abroad, plug into a local, shelter or a local mental health organization? Yeah,
any of those local shelters would be a great place to start. And then, there are community agencies all the time that provide sometimes just like funds to help pay bills or funds to help pay a hotel bill and stuff. And reaching those community agencies too, they're serving them to make them more aware, they're living in a hotel and these are the increased risks that they're at, and it's very likely that not only the child is going to experience maltreatment in their lifetime, but that the parent probably did too. And there's just all of these multifaceted layers of trauma that these families have undergone, and really preaching for the need of therapeutic care. And so I would just really like to see that this invisible population becomes more visible in our society, and that people become aware, of the trauma and significant need right in your own backyard, in your own community. I'm Jenna Montgomery Armstrong, and I'm a PhD candidate at the NC State University, and I work under advisement of Dr. Mary Haskett.
My guest, Jenna Armstrong, Montgomery Armstrong, and Sam P.K. Collins. They were gracious enough to interrupt their schedules. I spoke to Sam P.K. Collins from his offices in Washington, D.C. Jenna Montgomery Armstrong was on vacation, and she was gracious enough to take some time out and away from her family to speak with me to complete this episode. That is very, 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 very important. You heard me use the phrase NAMI. That stands for the National Association on Mental Illness. A fabulous organization. I am a member, so I am a bit biased. But the cool thing about NAMI organizations is that they have local chapters with folks who live in your neighborhoods just about everywhere, certainly virtually everywhere, because if they're not right in your community, there are places that are within reach of your community. And even if you don't live in the same area where the NAMI chapter might be, they will still give you services, and those services are free. I want to thank my guest again, Sam P.K. Collins, mental or healthcare reporter with thinkprogress.org, and Jenna Montgomery Armstrong, PhD candidate in the Department of Psychology at North Carolina State University. I asked her whether or not it was okay to call her professor, and I don't want to get her in trouble, but she's going to be there very, very soon, and she sounded quite professorial to me. And for this episode of Mindset, Mental Health News and Information, I am your host, James Curtis. Dare to see mental health differently, because understanding why we do what we do can help us all do better. See you next week.